Good communication skills are essential for a positive interaction with the patient during the counseling session. Let's review the counseling skills used by the Contraceptive Choice Project, and then watch as a counselor demonstrates each one with her patient. Close-ended questions are used to collect factual, non-sensitive information.
Maria, do you smoke cigarettes?
Yes.
And for how many years have you smoked?
Like 2 years.
And how many cigarettes either a day or a week do you smoke?
Just like 2 a day.
Open-ended questions are used to elicit feelings and detailed information.
What do you like about this method?
Well, I like that it's highly effective, it works for 10 years, and it doesn't have any hormones.
And how do you plan to protect yourself from sexually transmitted infections?
Well, my boyfriend and I use condoms regularly, and we get tested as well.
Probing questions are used to elicit more in-depth information.
Have you ever been told that you had high blood pressure?
One time, but I don't think it was anything serious.
Can you tell me a little bit more about that?
Yeah, one time I went to the doctor and he said it was a little high, so I went back for a few more checkups and it was fine then. Maybe I was just a bit stressed.
Okay.
To get the information you need to help a patient, you must listen actively. This technique involves communicating, without words, your interest in the needs the patient expresses. You can open up communication by using silence. You can let the patient know that you are listening by maintaining eye contact, leaning forward, occasionally saying words like yes, and please continue. These are signs of respect and generate a feeling of well-being in the person who is being heard.
What method of birth control do you think you might be interested in today?
I don't know. I used the patch before, but it irritated my skin a little bit. I did like knowing that I got my period every month. And I liked the fact that my periods were shorter and lighter.
Okay, well, we'll definitely go over all of the different methods of birth control today and make sure that we answer any questions you have before you go.
Great.
The next technique you can use in a counseling session involves repeating, synthesizing, or summarizing what the patient has told you. This helps the counselor clarify what the patient is saying and helps the patient feel that she's been heard.
So, Maria, after hearing about all of your options, what method sounds like a good choice for you?
I don't know. I like the long-acting methods, but I'm not sure how I feel about irregular bleeding or not having a period at all.
So it sounds like you're interested in a method that's highly effective, but also a method that's going to allow you to have your normal monthly period.
Exactly. I think the copper IUD might be for me.
Okay.
This counseling technique involves clarifying the feelings the patient expresses in order to help understand her emotions. It is helpful to patients to let them know that their reactions to a situation are normal and that those feelings are common to other people in similar situations. You can communicate that the feelings are valid.
Is it safe not to have your period every month?
It's completely safe not to have your monthly period if you're using a method of birth control that has hormones.
I would be worried I was pregnant.
You know, and it's completely normal to feel this way. So it sounds like having a monthly period is important to you and you want a method of birth control that's going to allow for you to have that.
Yeah, I think I do.
Okay.
Before you give any information, it is helpful to ask questions to determine how much the patient already knows. It is important to provide information using words that the patient can understand. Ask the patient to repeat the information you have given her to verify that she understood.
Okay, Maria, so I talked to the clinician, and she does want to send you home with a pack of pills for the month and then bring you back for your IUD insertion once she can reliably rule out any chance of pregnancy. So are you familiar with how to use the pills?
I've taken them once a long time ago.
I want to make sure you leave today completely aware of how to use them. So we recommend the Quick Start method, which means that you're going to take your first pill today. You will need to use backup contraception such as condoms or not have sex for 7 days. So you may have some breakthrough bleeding. This is completely normal. Just continue taking the pills as directed. Take one pill every single day around the same time. And then when you reach this last row of pills, these are your inactive pills, so they contain no hormones. This is the week that you'll get your monthly period. For some reason, if you don't get your period this month, you may want to consider a urine pregnancy test at home, or we'll be bringing you back into the clinic for your IUD insertion, so we can always do a repeat pregnancy test here as well. Some women think it's helpful to set an alarm on their phone or to download an app to their smartphone to help them remember to take a pill every day. If you miss a pill, then you do need to take it as soon as you remember. If you're more than 24 hours late taking a pill, take 2 the next day and make sure you use backup contraception for 7 days. If you've had unprotected sex and you're more than 24 hours late taking a pill, you may want to consider emergency contraception. So, do you have any questions about using the pill?
I don't think so.
Okay, so what's your plan?
Well, I'm going to take my first pill tonight at bedtime and make sure I take my pill every night around the same time. We're going to continue to use condoms, and if I miss a pill, I'm just going to double up the next day.
Okay, great. You're set. So you can just give us a call if you have any questions, okay?
Great. Yeah, thanks.
Great. Thanks, Maria.
The next essential counseling skill we will talk about today is arriving at agreement. This involves clarifying and summarizing the decisions that a patient has made during the counseling session.
Okay, Maria. So I'm going to go present your information to the clinician. If she thinks it's appropriate, then she'll insert your copper IUD today. However, if she's not comfortable inserting it today, then we'll send you home with a bridge method for a month and then bring you back and do a repeat pregnancy test and then for the insertion. Does that sound good to you?
Sounds great.
Remember, sharing a reproductive health history and talking about contraception can be uncomfortable for some patients. Demonstrating effective interpersonal skills is essential to help the patient feel comfortable and respected during counseling.